أهلا وسهلا. My name is Dr. Zaki Almallah. I'm a physician here at Cleveland Clinic, Abu Dhabi. I'm also the clinical professor of urology. We're going to talk today on the problems that men and women face with their urinary symptoms and with bladder and prostate disorders. I'm very pleased to have Dr. Seema Sheth, my colleague at Cleveland Clinic Abu Dhabi. She is a physician, specializes specifically in women with bladder problems, but also she is the director of the residency program here at Cleveland Clinic, where we train our future urologists. So welcome, Dr. Seema.
Thank you.
Let's imagine a couple comes to see us, and we sometimes have couples come to see us, with, say, a 60 years old man with his wife who is 58. They had 3 children, delivered normally. They're grown up, and both of them are having some urinary symptoms, which is very expected at that age. So shall we start with the woman?
Sure.
Okay.
Yeah.
So she's getting up at night a couple of times, goes through in the day, roughly every hour and a half. She's troubled with trying to find toilets or restrooms around the malls or wherever she gets out. Sometimes can be very embarrassing when they're traveling to distant places or on the planes, and she sometimes leaks with urine. So what would be your approach to kind of such a lady who's really very embarrassed about all that?
Yeah, no, you actually phrased this beautifully, because I do think bladder issues are so insidious, right? That it takes years before people realize I'm finally fed up with this and I'm actually going to do anything about it. A very key point you said, it's amazing when patients come back after they're treated and they say, I no longer have to know where the toilet is in the restroom because I don't need to run to it anymore, and how life-changing that is, but how slowly that change happened in their life before they actually realize something's wrong. But yeah, I mean, I tell them thank you for coming in, because it does take so long, and it's kind of a very personal and somewhat embarrassing issue to talk about, even though it is so common. So we first talk, find out what they're drinking. Have they changed that? Most often they have. They're drinking much less than they used to. How well they're sleeping. Are they waking up at night because they need to pee, or they're just kind of not really sleeping really well, because we know that goes hand in hand as we get older. Talk about how many kids they've had and how the pregnancies were, if deliveries were easy or complicated. We, of course, do a physical exam, and I think this part's a little shocking to a lot of women, because they're very used to going to a GYN and getting undressed, but then to get undressed in front of another doctor is not really what they expected. But we do need to look, right? We have bladder issues don't usually come solo. They come in with other issues. They've got prolapse. A lot of women have menopausal changes to the genitalia as they age, all of which will contribute to their bladder issues. So they do get a really thorough physical exam. They're going to get an ultrasound of their bladder, make sure they're emptying properly, and that their bladder is actually doing what the bladder should do.
Yeah, and I suppose we do that same for men as well, in a way or another, because it is really very embarrassing. It's the going frequently, and we find this also in men, in that we think about a man of only the prostate, but the bladder has a significant problems with that. So people tend to go very frequent, get up at night, and that tends to be the most troublesome symptoms for a man as well. I mean, nocturia, or getting up at night, running to the toilet or the restroom all the time.
Right.
What I would like to kind of talk about, how people are embarrassed still so far to talk about this.
Yeah.
I mean, we talk about everything. We talk about intimate relationships. We talk about different things. But the bladder, still, people are very embarrassed. And quite often you see when somebody visits, they send their relative who's coming with them, and I'm sure they try to avoid talking to their husbands or partners about it.
Right.
So how do you find that embarrassment factor, and how do we encourage people to get over it?
Yeah, I mean, I think that's super hard, and I think this is a very important role in all the primary care doctors that these patients see, because when they come to see us, they don't really have that relationship with us the way that they've had with their doctor who's been taking care of them for years. So I think that role should start with those physicians to say, do you have issues with this? You should see someone for this. By the way, do you know that it's really common? You're not alone. Do you know that we can help you? You don't have to be leaking. But yeah, I mean, going from diapers as a baby to no diapers for most of your life and then back into some sort of pads or diapers, it's not something people really want to talk about until they're fixed. And then when it's gotten better, I find that they'll actually talk to their friends about it.
And I think the attitude to leakage, I mean, I remember very well obviously urology used to be a very dominant, a male-dominant specialty.
Yes.
I remember during my training, one of the kind of older generation professor, which I remember very well, he said, oh, so what? A little bit of leakage, so what? What's the problem? And then there was a very famous female urologist, kind of used to kind of that male dominant specialty, stood up, said, listen, so-and-so, why you don't get a 10 ml syringe and just squirrel it down your
Yeah.
on your clothes, and
Yeah.
you will just realize how bad even that little bit of leakage.
Yeah.
So I think, as an attitude of our doctors and nurses and healthcare providers, we need to have kind of a different attitude to that leakage.
But wouldn't you say, I actually think women are more likely to talk to about it than men are, right?
I
Wouldn't
agree.
you say?
I agree.
Yeah.
Completely. Shall we just move on to what sort of advances now in treatment that we have for what we call this condition, the overactive bladder,
Sure.
or the voiding dysfunction?
Yeah.
Obviously, medications, there are a range of medications, and what is the role of physical therapy and education?
Yeah. I guess to a little bit of a background of this, I will say, I think one of the frustrating parts of overactive bladder is that it's not, quote, it's not curable, meaning it's not like stress incontinence where we can do a surgery and they're just fixed, right? So one thing I try to tell the patients is that you and I are going to be partners in this for a very long time because it's not going to go away. I can manage your symptoms, I can take them away, but I can't cure you for a whole lifetime. And I think that's where physical therapy is really important because it's something that there's no downside to, right? Except for some time and commitment. There's only upside that it can help you. And it's one of those things I think people think is voodoo, that it may or may not help them, but it does. It does. It's surprisingly effective. It's not perfect, and that's why there are so many other treatments, but why not, you know? And I will always remember I had this patient come in, she's like, I'm going to the bathroom every 5 minutes, I'm going to the bathroom every 5 minutes, and she's like, I've seen so many doctors, I've tried so many medications, nothing seems to work, can you help me? And I found out she's drinking about 20 to 25 liters of water a day. I mean, it's unfathomable. I can't even understand how you can drink that much. Of course she's going to the bathroom all the time, right? So this is where we kind of talk about physical therapy and behavioral changes that you can make.
Especially that coffee now is
Yes.
everywhere. I mean, there's that kind of pandemic
Yes.
of coffee and people using coffee everywhere.
Yeah.
So
Or even
that's-
like this a little bit here and there, no big deal, but it adds up, right? Yeah.
And I think also physical therapy, people don't realize, or physiotherapy, how important for men as well. I mean, we see a lot of young men with what we call a post-maturation dribble, or leakage of urine once they finish, the
Yes.
little bits of it drops. And especially in this region where praying and whatever, people are very meticulous of not having any little bit of leakage.
Yeah.
But just don't realize, I spend all the time saying, well, listen, this is the only, they've gone different places, they've had tests,
Yes.
they've had scans or whatever. I said, well, really, it's simple. It's just you've got to improve that imbalance of muscle.
Right.
People just don't realize the
Yeah.
power of that.
Yeah.
Shall we move on to the advances in medical therapy and in other therapy for overactive bladder, both for men and women?
Yeah, I think I might be a little actually disappointed in this arena. You know, we have those 2 classes of medications, and we have an entire class with a ton of side effects, and then we've got these 2 other little medications on this side that they are somewhat effective, but I think you'd agree they're like 50-50. It's like a toss of a coin whether the medication's going to work or not, would you say?
And what's the role of Botox then?
Yeah, I mean,
'Cause in
yeah.
there has been a lot of been used for a long time, and it's really excites people in a way. You see the twinkle in the eyes when you mention, especially to women, about Botox and fillers, which we use commonly. You and I here at the Cleveland Clinic Abu Dhabi. So what do you think, and how do you advise people about Botox and fillers?
Yeah, so fillers have zero role for overactive bladder, and I think this also is a very confusing point to some patients, that we really do have to figure out what kind of leakage they have and target therapy towards that leakage. Otherwise, it's not very useful. But Botox is great. I mean, I think it's great. You're talking about an injection in your bladder. It takes like a minute in the office, meaning you can drive yourself here, you can drive yourself home, and you're good for 3 to 6 months. I think the only issue is, obviously, we're a society where men and women are getting Botox all the time, to our face, to underarms, to all over the body, that eventually patients are going to develop antibodies, right? Okay, we can move them to a different type of Botox. We're still going to have some issues with time. But in terms of not having to remember to take a medication every day, having a very localized response to a medication, meaning hardly any side effects, great. It's a great drug as long as your bladder works. But I know you do a lot of inner stims, right? You do a lot of surgeries here at Cleveland Clinic Abu Dhabi, and I just think that if patients were more willing to try that avenue, they may find even more long-lasting benefit, right? This is still something you have to come in for maintenance every 3 to 6 months, meaning you're kind of still stuck to me as your doctor for a very long time, at least 3 to 4 times a year. Maybe you can talk a little bit more about that.
Yeah, I'm glad you've raised that. I think we have the advances now in stimulation. We'll talk about tibial nerve stimulation and external stimulation in a minute. But since you've mentioned interstem, the beauty of this is that it really controls things for a long period of time. It's a small device, but I find people really resistant just to accept we're trying it.
Yeah.
It's like a chip, like a pacemaker. You insert under the skin, and that will control the leakage. And that could be a life transforming for many young women, young men, whatever, who are suffering from this. And even for older women, obviously, when the prostate symptoms comes around, it may be not suitable for everybody. So I think we really, as a community of urologists, we should encourage people to try these and new technologies and new devices. I mean, it's very acceptable to have a pacemaker of the heart. Obviously, it's not as serious as this, but it actually works very well in the technology. People get worried about how they can use it with scans or MRI, but with new technologies, these are really very good devices now.
Yeah, I've had a lot of patients also, are you going to see it? Am I going to feel it? Yeah. The reality is no, you're not. Exactly. You know, we're talking about a tiny incision on your buttock that no one's really going to see. So it's a great option.
How about skin stimulation, or what we call PTNS, or now obviously with all these different devices?
Yeah.
What do you make of that?
Yeah, that's actually a very exciting avenue. I think PTNS is amazing for the patients it works for, right? So we're talking a little tiny acupuncture needle in the ankle once a week for 30 minutes for 12 weeks. But recently, right, we've had a few other devices that don't have to be inserted. You can do them at home, you know, so you're sitting for 20 minutes watching TV, you just put this around your ankle, take it off, which great. I mean, yes, we know it doesn't work for everyone, but if it does work, why not? So now you're avoiding surgery, you're avoiding medications, and it's a great option.
A subject which I really wanted to kind of touch on is the complementary medicine and supplements. Obviously, men are very interested in things like saw palmetto for their prostate, or people talk about for other men's health, like L-arginine or whatever. Whereabouts in women, is there any role of supplements or complementary medicine? I know it's very controversial and the results are pretty patchy, but what are the roles in say, premenopausal or postmenopausal supplements?
That's a good question. I think there's a very good role in prevention of urinary tract infections with supplements.
With the cranberry juice?
Yeah, cranberry supplements. D-mannose to me is a supplement. It's not really a medication.
I advise people to take yogurt regularly.
Probiotics, why not? Yeah. I think even regulating the bowels will prevent you from getting urinary tract infections, but for leakage, not so much, unfortunately. At least not any research that I know of that's actually working.
Yeah. And anything else you specifically advise women with urinary symptoms before we move into talking about specifically in men, how we deal with this? Any specific advice?
I think probably one area that is very undertreated is treating patients with estrogen. So, of course, there's systemic hormone replacement therapy. This comes with its own risks, but in our general region, and this is becoming much more common practice, which is so great. But I remember when I started training, nobody was really talking about using any vaginal estrogen, and this is life-changing, right? We know that the bottom of the bladder has receptors for estrogen. We know that you can treat some patients with overactive bladder with estrogen alone, and it will fix their symptoms. So we're talking about from the age where premenopause starts, which is around 35, which is still so young if you think about it. And onwards, we're just having a drop in estrogen and a drop and a drop. And eventually, I get all these patients with burning with urination. They've had a ton of antibiotics for urinary tract infections, but they don't actually have UTIs, right? They just have symptoms of burning. And estrogen will take that away, which is just wonderful. But it will also help their overactive bladder, which is also wonderful.
Yeah. And I think people tend to get very anxious about estrogen, especially, but we really, as you said, we just really need to emphasize this is a locally given, correct? And we shouldn't have a really much systemic side effects.
Right. I mean, to the point, I tell them that I give my patients with breast cancer who are on active treatment of breast cancer, vaginal estrogen. And that's been shown for decades to be safe. So if it's safe for them, it's definitely safe for you.
That's a great message.
Yeah.
We'll move on now to the man who's in that room, and obviously we'll like to talk about what are the symptoms of the bladder and prostate, and also the impact on man's life and on the health of the family, if you like. I mean, obviously, both for both people.
Yeah.
What would be the things as say if you are a family, what would be the concern about a man's prostate or a bladder? What do you think? What do people talk about this, or your patients? Do they talk about their husbands or mention their husbands when you are saying, well, I have urinary symptoms or whatever? Do they mention their partner or their husband at all?
Rarely. Yeah. They will say that their husbands get up a lot at night to pee. I think that's because it's disturbing them. I don't think they realize what's happening during the daytime is also a problem, right, in the men. I think I'll flip the questions to you because I hardly take care of men anymore, and you probably do a lot more of this than me. But, I mean, I'm sure you see the men who are the slowing of the stream as time goes on to the point that they're in the bathroom for longer. They don't feel like they're emptying properly.
Yeah, so I think it is again there is more awareness of the prostate now, but it's still there is a generation of men still very kind of careful about talking about this, and they just don't realize the link between urinary symptoms and prostate, and the impact of the prostate on the bladder, and they don't realize how kind of treatment is advanced. Obviously, main concern people are cancer, prostate cancer, which is true. But the majority of urinary symptoms are due to enlargement, benign enlargement of the prostate, which not many people kind of realize in a way. And it's interesting way, I think, sometimes women push their husbands to come for
they
that.
They do,
Because, I mean, women are more kind of health conscious in a way.
Maybe less stubborn, Zaki.
Possibly, yeah, as we know. I think advances in prostate treatment has really gone along. Obviously, you've got the long-standing medications, but now really people thinking or talking about the concept of why taking medications for a long period of time with the availability of different kind of therapies.
Yeah, I think really one of the biggest concerns that men have are twofold, right? They don't want to lose their erections. And they don't want to have retrograde ejaculation, right? They don't want that feeling that something's going the wrong direction. And maybe it's what's really preventing them from wanting to have surgery. But there are so many options now. And I know you do quite a few of these.
Correct. So really the whole advances in the last kind of 10 years has been focusing on preserving the sexual function or
Yeah.
men's health in
Yeah.
a way of preserving ejaculation, preserving sexual function. And treatments, especially now with the aquablation, which
Yeah.
is the new treatment, which is the water jet clearing, which is a robotic procedure that gives you a precise resection of the prostate or cutting of the blockage part using scans. It uses less heat because it's a water jet, so that's avoid the traditional surgery with kind of laser, which develop a lot of heat. But more importantly, in around 95% of patients, between 90 to 95% of patients, we preserve ejaculation, which is really the problem
Yes.
that we faced in the past with all prostate surgery. Therefore, more men now are willing to accept these procedures.
Yeah, I mean, we don't really want to trade one problem for another problem, right?
Correct.
Nobody wants that.
Correct.
And I think that's why men end up taking care of themselves so much later. But like you were talking about, alluding earlier, the prostate and bladder go hand in hand, right? So they take so long to take care of their prostate that they have somewhat of an end-stage bladder, and I'm sure you've seen patients like that.
Yeah, so that they damage the bladder, and I explain to patients is similar to having a water pump. And if that water pump is blocked for a long time, that water pump will blow up.
Yeah.
And then even relieving the blockage may not improve the bladder. So it's important to take action kind of
Earlier,
and
right.
I really would like to get the women's or the wives or the partners, female partners in the audience
Yes.
to encourage their husbands and their male partners to actually come forward
Right.
and sort out the problems.
Right. True.
So I think it's a kind of been interesting journey with this, the bladder and the prostate, the bladder for the women, the relationship with changes in age and menopause.
Yeah.
So let's leave it for the final word, Dr. Seema.
Okay.
Go on, tell me.
You mean what I would tell the audience?
Yes.
Okay. I guess I would say that these issues are super common. They're definitely not normal, but they are very common. Please take care of yourself and come see one of us. I promise you we are very caring and very gentle when we talk about this. And probably these issues affect the two of us as well, right? So we totally understand what you guys are going through, and we're here to help. That's what we're here for.
And from me, I think, again, for both men and women, you need to speak up. You need to come, mention it to people. There are many treatments for the bladder, as we alluded earlier on. There's the medications, physical therapy, Botox, fillers, stimulators, chips, and everything. And for men, there is various treatments, especially for the prostate, and new therapies and new technologies. And there is always help. And thank you very much for everybody, and thank you for listening.
Thank you.
you.